We are actually honored to have Virginia Therapy and Fitness Center join us today by some of the nation's leading physical therapists. And in fact, they've recently been named by Virginia Living Magazine's Best Physical Therapy Group. So congratulations. We'll be speaking with Rich Banton, Carrie White, and Paul Ellington. So thank you very much for being with us here today.
Thank you.
Thank you.
I'd like to start with Rich. As a physical therapist, what do you think in the continuum of care is the most important thing for patients to realize?
That physical therapists are movement specialists. And so just like you take your car in for a checkup, you should do the same thing with your body. Come see a physical therapist every 6 months, once a year before you have pain, because it's easier for us to fix things through preventative maintenance than until waiting until things break down.
What sort of preventative maintenance should be on people's radars? Carrie, would you mind speaking to that?
A lot of it is just taking care of your body, trying to have some sort of exercise regimen. A stretching protocol is good. You're just like we take vitamins and minerals every day. You need to take care of your muscles and your body in that aspect too.
Thank you. Rich, did you have anything to add to that?
Only just to kind of reiterate what Dr. Schuler said and Dr. Haynes earlier is that it's important to identify what the pain generator is, and physical therapists are a big part of that team in doing so. So you can't treat what you don't know, and physical therapists have excellent skills at what we call differential diagnosis. We can help patients determine what type of tissue is actually involved in their pain, which kind of helps us narrow down the best treatments to help them achieve better outcomes.
In order to achieve those outcomes, what would you say patients' goals are? Or what are your goals for your patients?
There's three important goals with any patient that goes through physical therapy. The first one is education. So the more they understand about their disease or their injury or the healing process, it kind of curbs the fear that they have entering rehab or going through surgery. So education is a big part of what we do as physical therapists, and that's certainly probably the most important goal. Secondly is it's important that we give patients a strategy, kind of empower them to be part of the healing process, kind of give them solutions. Patients that are more active in physical therapy compared to passive have better results. And thirdly, we create an environment for healing to take place. That's what I tell every patient that comes through the door is, our goal is to create an environment for healing to take place. We have a lot of skills and tools available to us to help patients achieve that goal. So I would say education, empower them to be part of the process, and create an environment for healing to take place. Those are main things.
Paul, can you speak on what you specifically do in order to promote that environment of healing?
Yeah, absolutely. So something we'll touch on later is the fact that Carrie and I are both health coaches as well as physical therapists. So a lot of what we look at is the bigger picture. So in our current healthcare system, you have surgeons that will do surgery and physical therapists that can help with the recovery from surgery, dietitians who address your diet, but there's not really someone who addresses that big picture, and that's where health coaches can come in. So things that I like to do with my patients is identify what they are most lacking in their life. Sometimes it is diet and exercise, but sometimes it's sleep quality and sometimes it's stress reduction. And all of those things are critical factors in how our body is able to recover. So as Rich was saying, we want to create the most hospitable environment in your body to allow for that recovery. So from a health coaching standpoint, just an overall wellness standpoint, that's what we like to look at, is make sure that we're not neglecting one factor, and we look at the patient as an overall human being as opposed to just, are you moving correctly or are you in pain? We want to look at the big picture and make sure we're not neglecting anything.
Absolutely. So you're speaking right now to the physical body, but the mental body, and obviously patients who are suffering through pain or recently coming out of surgery or facing surgery, there's obviously fear involved. Rich, how do you find that patients deal with fear and coming to you for help?
Well, fear's a normal thing that any patient should experience, and it's actually expected. And there's many factors involved in why they have fear starting rehab. One might be that, MRIs, compared like a spine injury to an ankle sprain. MRIs and x-rays are more commonly used with spine injuries compared to ankle sprains, and that's fearful for some patients. They may also have a history where a family member was disabled because of a spine injury, and so they fear that they're going to be unable to care for their family, be financially stable. And so that's part of the education, again, for physical therapists, is that we kind of help curb those fears. And I think another factor with spine injuries is that, compared to other injuries in the body, is that patients can't see their back. So if I sprain my thumb, I can look at my thumb, I can move it, I can see that it's not fractured, I can touch it, I can feel that it's not swollen, but patients can't see their backs. And so again, that's kind of the role of a physical therapist, is to kind of educate the patient that things can heal and most likely will heal within 6 weeks if you follow the right prescription from your doctors and PTs.
And PAs.
And PAs.
Now, you mentioned not being able to see your back. Obviously, there's image testing, MRIs, CT scans, and for someone who hasn't experienced that yet, that may be scary to them. As a physical therapist or a health coach, do you guys help coach your patients through that process?
Absolutely, and Dr. Schuler mentioned that life is a degenerative process, and what patients need to know is if you took 100 people off the street that didn't have back pain, and they were over 40 years of age, and you did an MRI or an x-ray of their spine, you would see degenerative processes. You would see disc herniations, you would see annular tears, you would see fissures. And these patients don't have pain. So just because you see an image of something in your back that seems scary or sounds scary, it's not necessarily a pain generator. And that's another role of a physical therapist, is to kind of work with physicians to help understand what actually is causing the pain in that patient.
So again, it's that continuum of care that's really important, and making sure that you're communicating with your team.
Right.
Yeah. Can I say one thing to that?
Yeah, Carrie.
Because sometimes patients, they have a lot of access to information prior to following up with the physicians, and they'll come in with their MRI reports and stuff to us, and they're like, look at all these things that are wrong, and so just adding to what Rich said, it's just sort of, explaining some of those things and what they mean in terms of defining terms, and then, making sure, well, these are some questions you want to ask when you go in and see the doctor, and just, I think, understanding that and that process can help also diminish their fear to what they're heading into as well.
You mentioned being prepared to ask questions to your doctor or your provider. Can you give some examples for patients to think about what questions they should be asking?
If they're, if you're considering surgery, obviously there's a lot of questions that they, that they can ask. I think it's the most important thing is just understanding the process, and I think we've done a really good job of that today, in starting from the beginning and going to the end. And I think just knowing what the steps are, what the next steps are, and knowing what to anticipate will help. Just helps people understand the process and makes them feel better about what they're deciding to do, because it is a big decision.
Absolutely. I do feel like we need to rewind a bit. And Paul, you mentioned you and Carrie are health coaches. Can you give a brief description of what exactly a health coach is?
Sure. So a health coach is someone that can help you make life-changing differences that are sustainable. Again, in our current medical system, we don't really have someone that's going to address the big picture with patients. So that's what a health coach is trying to do. And whether it's the diet and exercise or the stress levels, we can really try and figure out what is most important to you. So the example I like to use with my patients is, do you just want to be able to take care of your grandkids, or do you want to go out and run a marathon? That's obviously going to change the continuum of care and what we're trying to help these patients achieve. So when you sit down and talk with a health coach or a physical therapist, what we're going to do is identify what is most important to you and set goals that are meaningful to you. I like to ask patients, where do you see yourself in 6 months, and where do you see yourself in 5 years? Because if we can set those smaller goals and start achieving that, you can get the momentum going. And when you start achieving these smaller goals, those small things can lead to really big changes over time. So I think that's more or less what a health coach is involved in. And obviously, with all of us being physical therapists, we tend to specialize more on the musculoskeletal side of things, but we need to make sure we're not neglecting the psychosocial part of things, like you were saying, that mental health aspect. And that's kind of where the health coach comes in versus what we do as physical therapists.
Sure, that health coach doesn't specialize in one particular training or one particular area. You are much more broad.
Right, so we're trained to look at the big picture, but there's obviously a need for specialists, and we know who to refer to and when it's the appropriate time to refer to a spinal surgeon or a dietitian if it's outside the realm of what a health coach can adequately do. So what we like to do is set those small-term goals, make sure that the wellness component of their life is really being touched on.
Thank you. Carrie, do you have anything to add to that?
I think, not everybody knows, it's a growing profession, health coaching. It's actually kind of exploding in the wellness industry. So people aren't always familiar with what we do, but I think some people are really ready to take on their wellness and make some changes. But a lot of times they're afraid to reach out to people like us because they're afraid that we're going to take away everything that they enjoy in life. And that actually couldn't be further from the truth. So, it's important to meet people where they are when they're going to be making changes. And a lot of times, it's good to start slow and steady. And it's not necessarily about taking things out of your life as it is adding things into your life that are going to augment your life and help and help you feel better in the long run. It can be as simple. Some people come in and they are very self-aware, and they can be like, I understand that dairy upsets my stomach and I'm ready to take it out of my diet. Can you help me? But other people don't know where to start, and they just want to come in and know that they need to work on their health. So we can meet them where they are, and it's about helping them set goals. It's very individual, and it is very self-guided as well. So you can start and go gangbusters, or you can just start off simply, let's go home and have you cook from, in your own kitchen twice in the next 2 weeks and see how that goes. A lot of times when people start to make small changes and then they feel better, then they're really ready to get going.
It sounds like just similar to the recovery after surgery panel, setting those small attainable goals is really key here in that commitment to wellness.
Absolutely.
Rich, you have recently developed a wellness program at Virginia Therapy and Fitness Center. Why did you decide to do that now?
Because we felt there was a gap between patients that were being discharged from physical therapy and moving on to their personal trainer. So a lot of times insurances only allow patients to go to physical therapy for about 6 weeks to 12 weeks, and they clearly need more time to heal. So the wellness program's a great adjunct to take them into their return to sport, or help them get back into the gym where they can work with their personal trainer. So that was the primary reason. And as Paul and Carrie alluded to, just looking at the big picture of wellness is something that in the past, I've been a physical therapist for 25 years, and that piece did not exist in the past.
Yeah, feeling that niche and that continuum of care. Thank you for having that foresight. This question is to both health coaches, Carrie and Paul. When someone is ready to address their health and wellness concerns, I think you may have highlighted on this before, but is it really something that has to be done all at once?
Yeah, I sort of touched on that before, but it does not. I said everybody has a different pace. Everybody has different things that they're willing to do and to achieve their health and wellness, and it just begins with starting where the patient is and just going through their health history and discussing their goals. And like Paul said, where do you want to be 6 months from now and a year from now, and then start. Some people are ready to start really quickly, and other people are not. And it's just it's taking what you're ready to do and going from there.
Yeah, so I think it goes back to taking those patients from where they are and making sure that we're setting goals that are meaningful to them. If they just want to be able to play with their grandchild without pain, then maybe our goal is 2 weeks from now you'll be able to get up and down from the floor without pain. Whereas some people are going to come in and say, I want to completely redo my diet. And if that's the case, then they're clearly a little bit more ready to start, and we might set some higher end goals and higher level goals, but that doesn't mean that we can't meet with somebody and set the one goal to say, cook in your kitchen. You eat out 7 days a week, why don't you try eating out 6 days a week? And that's a small achievable goal. You don't need to go from eating out every day to cooking at home every day, because realistically, that's a burden, and not many people are going to be ready to make such a life-changing difference overnight. So I think Carrie hit it on the head with meet the patient where they are, and if they're ready to make small steps, then we'll allow them to do that. But if they're ready to run, well, let's run with them.
Absolutely. Thank you. We actually have some questions from the audience. These are people tuning in. This is Chris from Maine. And he's asking if you can comment on the hazards of the internet self-diagnosis. Who wants to take a stab at that?
I'll take that
Paul,
one.
all right.
So as I like to refer to the internet self-diagnosis as Dr. Google. So when you Google something, why does my back hurt? Chances are you're going to find some page on WebMD, and cancer is always going to be on there because everyone is going to have cancer via WebMD. But what I like to tell my patients is when you see that MRI report and it has all these big medical terms, a lot of our patients come in and they want to know what it is. So I think Rich had already talked about the education factor of our jobs, and that's where we come in both as physical therapists and health coaches, is to educate our patient and say, you know what, if you're over 40 years old, there's a chance that we're going to find a disc herniation on an MRI, but that doesn't necessarily mean it's your pain generator. But a lot of patients come in and they're scared, and that goes back into the fear, which we've already talked on as well, is sometimes we just need to be a voice of reason for our patients and make sure that they fully understand what's going on within their own body to try and talk them off the ledge and make sure that they understand that not everything on an MRI finding is crucial to what is causing them their discomfort.
Thank you. Rich, I think this next question may be for you. When you're hiring physical therapists into your practice, and from a patient point of view, this is specifically coming from Sue from Massachusetts, what makes a great therapist? What makes great therapy?
The more tools you have in your toolbox, the more capable you are of treating patients. So some patients need exercise. So a good physical therapist is trained in how to stabilize and train core muscles to make muscles stronger to help stabilize your spine. Some patients need dry needling, which is a technique we use to release tension in muscles. And so physical therapists have to be trained in how to use dry needling or other soft tissue techniques to release tension in muscles. And then some patients need mobilization or manipulation, and physical therapists are trained in how to mobilize and manipulate joints. So, the more tools that you have available to you, the more success you're going to have and better outcomes you're going to have with your patients. So that's something we look for. Is have they been enrolled in manual therapy curriculums? Have they been recognized by their peers as orthopedic certified specialists? And those are things that we've been fortunate to find through the last 20 years.
And that's what patients should be looking for as well.
Right, absolutely.
Well, Carrie, you are very experienced, but you also have a personal story to share, if you wouldn't mind. Your journey to wellness and how that relates to the audience, and share what type of lessons you learned along the way.
Sure. About 5 years ago, I had Lyme's disease, and it was really stressful. I had a 4-year-old who was having asthma attacks, and I had an 18-month-old who was dealing with food allergies, and then I had Lyme. I had to stop working because I was in so much pain, and it was very stressful. But I was able, through some great practitioners and integrative medicine, I was able to heal. But I feel like a lot of the lessons I learned along the way that definitely prompted me to become a health coach, because I feel like they can go across to anybody who's healing from any type of medical condition, and especially what we're talking about here today, to spinal surgery. The number one thing I feel like that I learned about was managing your stress. So I was under a really, really stressful situation, and managing, stress can be toxic, and really important to have the tools to manage that when you're trying to heal and be able to give your body the best healing environment. So as health coaches, we definitely work with people to give them the tools to learn how to manage their stress. Second is nutrition, obviously. How we fuel our bodies is how our bodies definitely affect how our bodies are going to heal. So talking to people about the right foods to eat, especially when you're talking to people who are going through surgery. We try and introduce more anti-inflammatory foods and get them to work on their diet, preferably before surgery, but a lot of times is part of the journey after surgery and the total healing process. And lastly is going to be
sleeping patterns?
Sleep patterns, yes. When people are heading into surgery, have had pain for a really long time, as a lot of our patients do, or taking a lot of pain medications, they come into surgery very sleep deprived, potentially. And so after they've gone through the process and they're in the post-surgical phase of healing, a lot of times those processes will return naturally, but not always. And so a lot of people need some tools to help them get through or be able to restore proper sleep patterns so they can continue on their healing journey. So those are probably the most important lessons that I learned, and we, like as health coaches, those are important things that we share with them.
Thank you for sharing your personal experience. It's really inspiring to see you put your passion into action, so thank you. And in closing, we've talked about what a health coach does, the importance of good quality physical therapists, but where do you find a health coach? Paul?
So right now it's a little bit harder because it is a newer field. It's a lot in the wellness industry, so there's a lot of people on social media that are promoting that wellness component. But right now, you can go online and you can search for a health coach. There's a lot of different organizations that teach health coaches and certify them, so you can go through the agencies to be able to find them. But you can also just go online and search for a health coach in your area. The biggest thing to look for is obviously that they are in fact certified and have taken some form of formal training in that before going and scheduling an appointment.
Wonderful.